This is a great topic to take together because the two procedures are frequently performed together. When we do a brow bone reduction, which as a surgical technique has options that are exclusive to itself, we do it through an incision that can be done to make hairline changes if the person would like. So ultimately, that incision is, in a general sense, called a coronal incision, which means it goes up and over the head like a crown. And it can be placed either in front of the hairline if a person is looking to change the shape of their hairline or have their forehead length reduced, or it can be placed behind the hairline if a person is looking for a more hidden scar. So it's a really important consideration to understand for those that are looking to have any of those changes or brow reduction about if they would like to have the hairline position changed and they're willing to accept a scar that's ultimately in a visible location, or if they would like to have the scar in a hidden location but not have any changes in their hairline. Maybe in that case, if they'd like, they could do hairline changes through hair transplant or something along those lines. Now for the brow reduction, there's a few options. And what we find is that it's actually the frontal sinus, which is the contributor to brow prominence in those that have undergone a testosterone-based puberty. So in this puberty, the brow enlarges, that frontal sinus gets bigger, and that's what we're looking to reduce. As a sinus, it's associated with a very thin wall of bone on the front. So if we're looking to change that shape, we can't burr it down or kind of medically sand it down like we can in other parts of the face. So we have to remove it, change its shape, and then add it back on. That's called a frontal sinus setback. And it's done as opposed to contouring or burring. About 95% of people have that configuration of their brow bone that they're going to need the frontal sinus setback.